Hi, Assalamualaikum warahmatullahi wabarakatuh. So our group going to present about the fracture and dislocation. Before we get started about the presentation, first I'm going to introduce myself. So my name is Siti Nurshawah binti Shamsuddin from class SR 113 4D. My metric number is 2019257906.
Assalamualaikum warahmatullahi wabarakatuh. My name is Akila Syairah binti Nordin from class SR 113 4D. My number ID is 2019245196.
Hi, Assalamualaikum warahmatullahi taala wabarakatuh. My name is Nurul Maizura binti Hamzah and my ID student is 20194488 and 32.
Hi, my name is Nur Nasraya binti Muhammad Jeffrey. I'm from SR 113 4D. My ID student is 2019242012.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Nazrin bin Nur Ismail and I am from SR 113 4D.
Assalamualaikum warahmatullahi wabarakatuh. My name is Arif Fakri bin Zamrun.
As I'm the first presenter of this group presentation, of course, I'm going to talk about the definition of the fracture and dislocation. First, we are going to go through about the fracture. So, what does it mean by fracture? So, fracture is complete or partial break in the continuity of bone. Most of the fracture result from force applied to a bone, which means there's something hit the bone from the parallel direction, like this, from this, that make it the bone break or crack. Now we are going to move to the definition of dislocation, or the root word is dislocate. So, dislocation or subluxation is complete displacement of a joint from its normal alignment. In another word of dislocation is the joint at any part of our body were moved from the place that it should be. This painful injury temporarily deforms and immobilizes your joints. Now, I'm going to pass this presentation to the next presenter that are going to go through about the types of the fracture and dislocation. Thank you.
Now, I will present about my presentation, types of fractures and dislocations. Different types of bone fracture can be open, closed, stable, displaced, partial, or complete. First, transverse fracture. Transverse fracture are breaks that are in a straight line across the bone. This type of fracture may be caused by traumatic events like falls or automobile accidents. Next, spiral fracture. This is a kind of fracture that spiral around the bones. Spiral fractures occur in long bones in the body, usually in the femur, tibia or fibula in the legs. Spiral fractures are caused by twisting injuries sustained during sports, during a physical attack, or in an accident. Next, oblique fracture. An oblique fracture is when the break is diagonal across the bone. This kind of fracture occur most often in long bones. Oblique fractures may be the result of a sharp blow that comes from an angle due to a fall or other trauma. And for the last one, comminuted fracture. A comminuted fracture is one in which the bone is broken into 3 or more pieces. There are also bone fragments present at the fracture site. These types of bone fractures occur when there is a high impact trauma, such as an automobile accident. Green stick fracture. This is a partial fracture that occur mostly in children. The bone bends and breaks but does not separate into 2 separate pieces. Children are most likely to experience this type of fracture because their bones are softer and more flexible. The elbow is the second most common dislocation in adults. It takes a lot of force to dislocate the elbow. The most common cause is falling and landing on your outstretched hand or arm. pushing the forearm bone sideways out of the joint. Sports like cycling, rollerblading, skateboarding, and gymnastics tend to be the most common sports-related causes. Dislocation of knee joint is rare but can be catastrophic. It is mostly like to be caused by a road vehicle accident but can also happen in sports, particularly skiing. There is usually significant injury to the ligaments of the knee as well. Kneecap dislocation. The common dislocation is actually not a dislocation of the main knee joint. Instead, it is of the kneecap from its position in front of the main knee joint. Patella dislocation is particularly common in teenagers, especially girls. It can happen during sport, but also when getting up from a chair or the floor. Hip dislocation. Sudden hip dislocation is a medical emergency when it occurs in adults. It is very painful and can result in significant bleeding into the joint and tissues. The hip is a stable joint seated in a very deep socket and well protected by large muscles and strong ligaments. Wrist dislocation. Wrist dislocation means dislocation of any of the 8 small bones which make up the wrist. It is usually caused by a fall onto the wrist or the outstretched arm. Symptoms include pain and obvious distortion of the wrist. Last but not least, dislocated finger. This is a common injury which can affect any finger joint but which most commonly affects the middle knuckle of the forefingers. It is usually caused either by overbending the finger backwards or by jamming or catching the finger somewhere during fast movement.
So for the next is the causes of bone fracture and dislocation. Both causes of bone fractures and dislocations are the same, so that's why it is only have one slide. So for the first is bones are actually the hardest tissue on our body, but if we put too much pressure or force, the bones can break or split. There are two of the most common bone and joint injuries, which are fractures and dislocation. Fractures is when it happens to the bones when the bone is break, while the dislocation is the two bones are split and the joints are split. So healthy bones are actually extremely tough and resilient, so it can withstand with any powerful impacts or any greater force. But there are some causes that can cause the bones to break or the joints to dislocate. So for the first causes of bone fracture and dislocation is overuse injuries or stress injuries. Overuse injuries is often happens due to repeated stresses or strains. This always happens in the fibula, tibia, or metatarsal, and these injuries is actually commonly found among professional sports people. For examples, for the fractures is Shahrul are playing football, but then the opponent is trying to tackle him from the back, and he falls, and then he went to the hospital, and the doctor said his bones is break. So for the next example is examples for dislocation. Let's say Izati is a basketball player, and her finger or her hands accidentally striking the ball, and that can cause a dislocation on her fingers or a hand, or maybe the elbow joint or the ankle joint. So let's move on to the second point, which is falls or accidents. Falls is when someone is fall from a high, or car crash, or gunshot wounds. This can happen. The break of the bone is happening because of the direct blow strikes to the body or the bones itself. So, for the example is, Shalwa is trying to help a girl from a high fence, and suddenly the girl lose her control and fall from the high fence. But the girl is trying to land on an outstretched arm during a fall, but the worst things happen. So, from the incident, the girl may get a bone fractures or the dislocation of her joints in any part of her body. So for the last point of the causes of bone fracture and dislocation is pathological fractures. This one's the meaning of this one is the fractures that is caused by any diseases such as osteoporosis, bone cysts, Paget's diseases, osteogenesis imperfecta. There are some conditions or some diseases can weaken the bones, which makes them more likely to break or fractures. So this one, for the people who are having osteoporosis, for example, they tend to have a higher risk to get bone fractures because of they are having the diseases. So by that, the people who are having osteoporosis, for example, they need to consume a high diet in calcium or protein to build a muscle and tissue, and to make the bone become stronger, so that they can prevent any broken of the bones or any dislocations of the joint. So that's all from me. Thank you.
So now I will present about symptoms for fracture and dislocation. Okay. Symptom of a dislocation vary depending on severity and location of the injury. Okay, the symptoms of a dislocated joint include fracture pain at or near the site of the injury for the symptoms of fracture and dislocation. Okay, so there are some symptoms that are present in an individual if he has a fracture or dislocation. Okay, first, a visibly out of place or misshapen limb. Second, swelling, bruising, or bleeding. In addition, the individual will experience severe pain. Other than that, numbness and tingling. Next, broken skin with bone protrusion, and lastly is loss of motion. Thank you.
Today, I want to talk about how to prevent from the fracture and the dislocation of the bone. Now, I will share a few ways to prevention for a bone fracture. First, you must eat your healthy diet. Keep your feet bone with a healthy diet, just like a calcium. I'm sure if I'm talk about a nutritious diet for bone health, you must think only the calcium. But vitamin D and vitamin K also are important as well. The second way is exercising. Exercising is more important to keep maintaining your body weight from a fracture. So, you must exercise regularly to make you more stronger and help you to avoid the falls. The third, fall-proof your home. You must keep your home well lit, so you are going to see where you are going in your home and avoid from falling and decrease your chance of falling in your house. Medications. Certain medications can increase your chances of falling due to the side effects that affect your balance. So, you must talk to your doctor about any balance issue as well as your fears of falling and resulting bone fracture. And now, I will share about the preventions of the bone dislocation. First, you must avoid from falling because the most risk of the dislocation bone come from falling. So, you must always take care and being cautious from the occurrence falling. If you an athlete, when you play sport, you must wearing the protective gear to avoid from falling and dislocation bone. You also must keep on a healthy diet to maintaining a healthy weight to avoid an increased pressure of the bone.
Okay, now we are going to present about diagnosis and fractures. How fractures diagnosed? Diagnosis testing for fracture may include X-ray, computed tomography scan, which is a CT scan, magnetic resonance imaging, which is a MRI, and a bone scan. Okay, now we go to the treatment for a fractured bone. The first one, we have a splints. The doctor will put the splint on the broken bone if they have a swelling. The splint will replaced by a cast once swelling has gone. Swelling are also used for a minor fractures. The second one, we have a boot. A broken ankle, foot or leg may be stabilized with a cast boot. And then the third one, we have a cast. Casts are stronger than a splint, and then it require protection to the injured area. The type of a cast used will depend on the type of fractures. And then next, we have a reduction. A reduction is a non-surgical procedure to set the bone so it will heal properly. The doctor will realign the broken bone from outside to the bone and put injured limb in a cast. Okay, next we go to the dislocation diagnosis and treatments. For diagnose this dislocation, the doctor will examine by X-ray and MRI. The treatment for dislocation might involve reduction. The doctor might try to gentle maneuver to help the bone go back to the position. And then next, we have immobilization. After the bone go back to the position, the doctor might immobilize the joint with a splint for several weeks. And then next, surgery. We might need a surgery if the doctor cannot move our dislocation bones into the correct position. And then the last one, we have rehabilitation. After splint is removed, we will return rehabilitation program design to restore the joint range of motion and strength. Okay, that's all from our groups. Thank you.